morning, everybody. Thanks for joining us. As some of you might know, I'm Tony from McLaren St. Luke's Family Medicine. As we do the third Wednesday of each month, give a talk on a different medical topic. And today we have Dr. Esther Buru from our Family Medicine Residency that's going to talk about managing hypertension, which is just a fancy way of saying high blood pressure. It's very important that we know from time to time what our blood pressure readings are so that they don't go too high or too low. Most people fall in the higher category when it becomes problematic. So it's something we need to really stay on top of. And because if we don't, there are certain risk factors or certain things that might happen, and she'll go into a little bit about that. The positive thing is we all have the ability to some extent to control our blood pressure. So she's going to talk about some of that as well and how to get our blood pressure properly taken. Just a lot of good information in a short amount of time. So I'll turn it over to her. We'll stick around in case you have any personal questions.
Yes. And before I start, I would rather you interrupt me to ask your questions than try to remember them for the end. As someone with poor memory, trying to put something off and saying, oh yeah, I'll bring that up in 5 minutes. It never happens. So, but I will be starting on the back page with the infographic, just because it defines the blood pressure. And so I want to focus on the top two spots where it talks about what systolic or the top number is and what the bottom number is. And so the top number is the systolic. That's the one that's usually 120 or above. That number is what the pressure in your arteries is when your heart is beating. And then the bottom number, diastolic, is the pressure in your arteries when your heart is relaxing or it's filling up with blood. And so we usually run into issues with high blood pressure as we get older with the top number, the systolic number. And then there's the infographic talking about how you're supposed to measure your blood pressure. So there are a lot of things that you need to make sure that you're doing when you're measuring your blood pressure. You're supposed to be seated in a chair that has a back. You're supposed to make sure your feet are flat on the floor. Your arms should be at the level of your heart. So there's a lot more involved with blood pressure, like with properly taking your blood pressure than you may think at first. Okay, and now to the front page. So some risk factors that put you, or some risk factors for developing high blood pressure or hypertension. So just getting older. As we get older, our arteries, they get stiffer. We're building up plaque, which is something else that's decreasing the size of the tube that our blood can run through. And all of these things means that our heart needs to work a bit harder to pump blood throughout our body. Diseases like diabetes or chronic kidney disease. So diabetes is another thing that can lead to stiffening of your blood vessels, and chronic kidney disease. If your kidney is not getting a lot of blood flow, as is the case with CKD, it releases these signals to your body asking for more blood. And one of the ways that your body sends more blood to your kidneys is by having your heart work harder. So increasing your blood pressure to get blood to your kidneys. Things like breathing issues. So if you have COPD, if you have asthma that you've had for a long time and isn't treated properly, or obstructive sleep apnea and you don't use your machine, and like you should, when your blood needs to get oxygenated, your blood needs oxygen. And so your heart is pumping blood through your lungs so that it can get oxygen. But if you have breathing issues, it's a lot harder for your heart to pump blood through your lungs to pick up oxygen. And then there are, so some things like family history. You can blame your parents in some cases. Sometimes it's genetics. You can do everything right and still have blood pressure issues. Unhealthy diet. So if you have a lot of salt in your diet, things like alcohol actually increases your blood pressure as well. So there's some dietary issues that can cause high blood pressure, and then obesity. And so obesity can also lead to elevated blood pressure. So then the next step, I've told you all of these things that can lead to high blood pressure. So what is high blood pressure? Technically, what is the cutoff? And so the governing body that we look to for advice on where to put that cutoff says that if you are under 60, we want your top number to be 140 or below. Well, below 140, and we want your bottom number to be below 80. If you are over 60, we allow your top number to go to 150, so below 150, and then the bottom number needs to be below 90. And then if you have diabetes, we want a bit stricter control. So then we have you go. I'm confusing myself with my words. We want you to be below 140 for the top number and below 80 for the bottom number. And if that was difficult to follow as I spoke, it's on your paper. Sorry about that. So if you go to your doctor's office, and you are over 60 years old, you have a blood pressure, the top number is over 150 or the bottom number is over 90, we don't automatically say that you've got hypertension, you have high blood pressure, let's start some medications. The next thing that we do is we send you home with a blood pressure cuff. So I have a lot of patients who have high blood pressure readings in the office. And sometimes it's because they're nervous to see me. I try not to take it personally. Sometimes it's just because they're nervous about being at the doctor's office, like they may get bad news. And so the doctor's office itself gives them anxiety. And sometimes they don't feel anxious and you never really know why, but they just have an elevated blood pressure when they come to the office. So I send them home with a blood pressure cuff. I give them this infographic and I tell them that I want you to measure your blood pressure every day at the same time of day, just because our blood pressure naturally kind of varies throughout the day. So I'll give them a log, tell them put your blood pressure cuff in a place where you're usually relaxing so that your blood pressure isn't going to be falsely elevated by like walking around or doing an activity. And I have them write down their blood pressures. Then they'll come back in with that log and we'll look and see if their blood pressures are elevated. So if they are up 150 or above, or the bottom number, if it's 90 or above. And then if they're elevated, if the blood pressures are elevated at home, that's when we give them the diagnosis of hypertension. And so you had the high blood pressures in the office, you took the blood pressure cuff home, or you got a blood pressure cuff, you measured it at home and it was elevated. The next step, when you come to the doctor's office next, we're going to do some more tests just to make sure there isn't an underlying cause that's leading you to have high blood pressure. We know that high blood pressure usually comes with things like elevated blood sugar or diabetes. It may come with kidney issues, so we run tests to make sure there isn't anything else going on. So some of those things are going to be like blood tests. We'll check your lipid panel to make sure that you don't have abnormal lipid levels. We'll check your blood for your kidney function. We might ask you to give us a urine sample, another way to check your kidney function. And then long-standing high blood pressure can cause structural changes in your heart or changes in the way the electricity travels through your heart. So we may also have you do an EKG. And so that's putting the patches on your chest and seeing how the electrical activity travels through your heart, just to make sure this hasn't been a long-standing issue. And that like your high blood pressure isn't just the tip of an iceberg that like we aren't seeing yet. And then we'll also do a physical exam to make sure that other structures haven't been affected. So if you have high blood pressure, you may have some trouble breathing because you have fluid in your lungs. So we listen to your lungs to make sure there's no fluid. We'll check your feet to make sure that you don't have any swelling in your legs. We'll look at your eyes just because there are a lot of small blood vessels in your eyes. And if you have high blood pressure, the vessels can't take that pressure. And so we may be able to see some damage in your eyes, which lets us know that you've had this issue for a while. And then, we'll also listen to your heart to see if you have any heart murmurs, if there's any issue with the way that your heart beats. But we do all of that testing, all of that looks normal for you. So you have high blood pressure. We caught it early enough where it wasn't high for a very long time. So you don't have any of those issues that we talked about with the swelling in your legs or the visual or the problems with your eyes. So the next step is trying to change some of those modifiable things. So I talked about one of the risk factors is being a dietary if you have too much sodium. So I'll give you instructions on some of the foods that you can eat to kind of lower your sodium or things to avoid. If you're a smoker, that was a risk factor that I forgot to talk about, no smoking. If you're a smoker, I'll encourage you to quit. I'll give you resources so that we can remove that modifiable factor. If you're drinking alcohol, well, like I'll advise you to decrease your alcohol intake. At physical activity, so we recommend 150 minutes of moderate physical activity a week. And so I'll give you examples of some things that you can do. 150 minutes sounds like a lot of time all at once, but giving you like ideas, you could have 30 minutes of exercise 5 days a week. And that seems more manageable than 150 minutes of exercise total, but exercise can help lower your blood pressure. So I'll mention that. If obesity is an issue for you, weight loss can help lower your blood pressure. So any amount of weight that you can lose will help your blood pressure. But we our one goal that we try to aim for when we first diagnose you with high blood pressure is 5%. So if you lose 5% of your body weight, it can result in like a tangible difference in your blood pressure. And so we try those changes first, and then see you back in a couple of months to see how your blood pressure has been doing. If your blood pressure is still high, then we'll start talking about medications. But medications aren't always the first option when you're diagnosed with high blood pressure. It depends on your specific risk factors. It depends on how high your blood pressure is when we see you in the office, things like that. And then I have a lot of patients who ask me why they need why we need to treat their blood pressure. Some people, they don't have any signs of high blood pressure, like they don't get headaches, they don't have any of the swelling in their legs, they don't have vision changes, they are breathing fine, they feel fine. The only thing that's wrong is that I'm telling them that their blood pressure is high. And so in cases like that, I tell them that high blood pressure, you may feel fine now, but if it's uncontrolled and we let it stay uncontrolled for a long time, there are some bad things that can happen. So prolonged high blood pressure increases your risk of stroke. It increases your risk of cardiovascular events, so an MI or a heart attack. And it can increase the risk that you develop things like heart failure. So your heart may not stop, you may not have a heart attack, but your heart won't function as well. And then that can lead to symptoms that will make you feel badly. And then end organ damage. So high blood pressure can lead to kidney disease. It could lead to changes in your vision just because of those like those vessels being damaged. It can lead to liver disease, and it can lead to long-term changes in your brain. So when a doctor tells you that I want to treat your high blood pressure, it's not just for like any symptoms that you're experiencing in that moment for high blood pressure. It's also to make sure that you don't develop these issues later on. That all makes sense. It's a very quiet crowd.
Any questions?